Good afternoon, everyone, and welcome to the State of Vermont's Children Briefing. My name is Dr. Morgan Crossman, and it is my honor to serve as the Executive Director of Building Bright Futures, which is Vermont's Early Childhood State Advisory Council. And I'm thrilled to be here this afternoon to share the most up-to-date data on the state of Vermont's children. So for those of you who may not be consistently involved in the Building Bright Futures Network, annually we produce the State of Vermont's Children Report as a tool for legislators, policymakers, and invested leaders to make data-informed policy decisions. So today we're excited to walk you through this data. We want to start this briefing by acknowledging the significant challenges that children, families, professionals on the ground, and our early childhood system have faced this past year resulting from the COVID-19 pandemic, and while operating in prolonged workforce crisis and a mental health crisis. In addition to serving in this role, I also want to let folks know that I'm the mom of a 4-year-old daughter who is accessing universal pre-kindergarten education services and special education services in Chittenden County. So I also want to say, as a parent or caregiver, I see you, and I see how you're holding on and continuing to navigate the challenges the pandemic is putting in our view. I also want to thank the early childhood workforce, and that includes every individual who's working with children and families in Vermont across all sectors. You are doing such an incredible job of supporting and caring for and educating our kids in the most challenging environment imaginable, so thank you. Like the country and the world, Vermont children, families, and communities are facing significant challenges, including equitable access to services, needing to build resilience, struggling with family safety and meeting their basic needs, engaging and partnering with families, and supporting an integrated system of care. And these challenges have been identified at every single level of the Building Bright Futures network. And partners at each of those levels are working to address these barriers. At the same time, we've seen significant investment in early childhood through both state and federal initiatives, including childcare, mental health, education, and after school, and that's just to name a few. But what you'll see from the data that we're going to present today is that there's so much work left to be done in the coming year. So thank you for joining us today. Next slide, please. Today's briefing is going to include a mindful moment that reiterates our collective vision for Vermont's children and families, brief recorded remarks from Governor Scott, a presentation of the 2021 data spotlight on Vermont's early childhood workforce crisis, a presentation of the highlights of the State of Vermont's Children Report, and a brief TA session on how we move policy recommendations into action. So you'll hear about a regional initiative called Step Up to Childcare, and from leadership from our Families and Communities Committee, where Jen Fortman will talk about family leadership and engagement and the progress we've made, but also where the opportunities lie. And then we'll conclude today's session with questions and a short discussion. So we always start every session with a mindful moment at Building Bright Futures. And to set the stage for the briefing today, our mindful moment includes the vision for Vermont's early childhood system that's outlined in the Vermont Early Childhood Action Plan. So I'd like to ask that you either close your eyes or focus on the slide that's on the screen right now as I walk you through the vision and the goals. In the year 2026, a child is born to a family in Vermont. We'll call her baby Mariah. Vermont is a state where all children and families are accepted for who they are. Mariah and her family are supported from the very start all the way through her development and education. Mariah thrives with the loving care of her family. Their home is warm and safe. There's food in the fridge today and on the horizon. The whole family is connected to their diverse community and can access high-quality opportunities that meet their needs. Mariah grows into a toddler, a preschooler, and eventually transitions into the local elementary school. She's resilient and able to navigate even the most difficult days she'll face. Mariah does not yet know there's a community holding her and her family through a seamless system of support. This is a system where all children have a healthy start, where families and communities play a leading role in children's well-being, where families have access to high-quality opportunities that meet their needs, and where the early childhood system is integrated, well-resourced, and data-informed. This is the future. So this afternoon, as we talk about the current status of children and families, I want you to hold on to this vision and reflect on where we are now and where there are opportunities to move even a step closer to that vision. Next slide, please. So now that we've oriented you to this vision that we've set for the system, it's really important for folks to understand Building Bright Future's role in supporting this system. So Building Bright Futures, or BBF, is Vermont's early childhood public-private partnership that's charged under Title 33, Chapter 46, and the Federal Head Start Act as Vermont's Early Childhood State Advisory Council. And that's the mechanism used to advise the governor and the legislature on the well-being of children in the prenatal period through age 8 and their families. Our mission is to improve the well-being of each and every child and family in Vermont using evidence to inform policy and bringing voices together to discuss critical challenges and problem solve. So our role in the system is to maintain the vision and strategic plan for the early childhood system, and we're charged with holding our partners in this system accountable to child, family, and system outcomes. So what you're seeing on the left-hand side of your screen is the Bbf Network Infrastructure, which includes over 450 stakeholders that are coming together on a monthly basis. And so what we want you to see in this visual is that we always start with holding children and families at the center of all we do, and we commit to using evidence and data to drive decision-making. We have 12 regional councils that touch every corner of the state and are identifying needs of kids and families. We have 7 Vermont Early Childhood Action Plan committees that are honing on specific policy topics and monitoring our strategic plan. And we have the 23-member governor-appointed State Advisory Council. And this body's charged with taking everything they've learned from this network, setting priorities, and then making recommendations for the coming year. So today's briefing, the State of Vermont's Children Report, and Vermont's Early Childhood Data and Policy Center, which can be found at vermontkidsdata.org, are 3 critical ways that BBF meets our key mandate in state statute for monitoring the early childhood system. And that includes outcomes for kids and families and advising the governor, the administration, and the legislature. So it's really important for us to understand where we are now and what to watch for in the future by reviewing this data. It's now my pleasure to introduce Governor Phil Scott, who's going to spend a few minutes talking about his commitment to supporting children and families in Vermont through his pre-recorded remarks.
Good afternoon. Thanks for having me, and to Building Bright Futures for putting together the How Are Vermont's Young Children report. This will be a helpful tool as we work on childcare and education policy this year, giving us a better picture of where we are right now and where we need to be to help our kids. So thank you to everyone who had a part in it. As I said in my State of the State address, the pandemic has taken a significant toll on our kids. I know the early care and learning community stepped up during this difficult time, including staying open when many sectors were closed. You adapted quickly and worked hard and continue to do so, and you have my gratitude. Your commitment to our kids made a big difference, but there's still a long road ahead in their recovery. It's clear we must stay focused on supporting and investing in them, whether in child care settings, the classroom, after school, or in the summer. Last year, my administration, with Senator Sanders, along with private partners, worked to expand after-school and summer programs. And why this year, I'll propose initiatives to increase access to and affordability of child care, building on the investments we made since I came into office. In fact, we've increased funding for childcare by more than 30% over the last 5 years. And, as I also talked about in my State of the State, we must also make sure we have the workforce to provide care for our kids. As we move forward, each and every one of you will be an important voice in the conversation to solve these challenges. Again, I appreciate all the effort and energy you put into this work and look forward to what's ahead.
Thank you to Governor Scott for your continued commitment to Vermont's children and families. Now I'd like to transition to Building Bright Futures Research and Data Director, Dora Levinson, who serves as the lead on this report, and she'll walk us through some of the limitations and things to consider about this data before we dive in.
Thank you, Morgan. Before we move on to the limitations of what will be presented today, I would like to thank the many organizations, agencies, and individuals who have made this report possible. The Vermont-specific data and the context that you have provided has enabled this report to more accurately reflect the state of Vermont's children in 2021. I hope that you find the various sections of this report to be helpful, with the policy recommendations and strategies, the snapshots of data, and glimpses of the work of each of Vermont's 12 regional councils. The commitment of all early childhood stakeholders in Vermont and the collaboration throughout all levels of the Bbf network is inspiring. A few key points as we move through today's presentation. When we reference the field or stakeholders or we're talking about the collective we, not just the small Bbf team or even the Bbf network, but the broad early childhood system and everyone engaged in supporting children and families. As you're listening today, please feel free to submit questions or comments in the chat bar or hold your questions until the end of the presentation. Although we will not be able to accommodate all live questions, we will host a brief discussion after the official briefing is completed. We are also happy to connect with you directly to address questions afterwards. Lastly, like all SAC and VCAP meetings, today's briefing will be recorded. The recording, slides, and report will all be easily accessible through our website this afternoon. Now on to several limitations of particular note. The state of Vermont's children is focused on children from the prenatal period to age 8 or through 3rd grade, as well as their families. What we have included throughout the report is the most high quality, up-to-date information available as of December 2021. The data we report is often released 6 months to a year after it is collected. The data sets also focus on different age ranges, and the time periods are not necessarily comparable. This report also uses proxy measures because of Vermont's small population and the current data infrastructure. For example, mental health services and childcare utilization data is available and reported, but the demand for these services is not currently measured. Last year's report only included 2020 data in the COVID-19 spotlight. However, this year, 2020 and 2021 data have been included throughout the report, although for many indicators, we still haven't seen the true trend or impact of the pandemic. Lastly, the information presented in this report is just a snapshot. There is always more to the story. Morgan will now walk us through this year's data spotlight on Vermont's early childhood workforce crisis.
All right, so let's dive in. The first data we're planning to present today is on our data spotlight, which is Vermont's early childhood workforce crisis. So why is this the spotlight in 2021? We have heard from countless members across the Bbf network about the challenges that contribute to and result from the early childhood workforce shortage. So we know 7 out of 12 of our early childhood regional councils called out the workforce as one of their top priorities for 2021. And while this has been a long-standing issue, the pandemic has only exacerbated it to crisis levels and become a top priority across the state. And when we're talking about the early childhood workforce, we're talking about mental health providers, early childhood educators, pediatric health providers, early interventionists, and a range of other critical individuals. We've consistently documented concerns related to finding, retaining, recruiting, and supporting a strong workforce. And each individual working in this early childhood field plays a really important role in supporting Vermont's children, families, and the future of communities and the economy in Vermont. So next, we'll highlight this compilation of data. And I want to start with the childcare workforce. Next slide, please. So what you're going to be seeing in this chart is that between December 2018 and December 2020, there was a 14% decline in the number of individuals working with children in regulated childcare settings. So in other words, there were 1,200 fewer individuals working in these settings over this time period. And one consequence of having so many vacancies in this sector is that 27% of Head Start and early Head Start slots were unable to be used or accessed by families. And partners have suggested a range of factors that likely contribute to these vacancies. So the first is staffing changes during the COVID-19 pandemic. So factors like age, underlying health conditions, a shift in priorities for parents and caregivers of young children, and the guidance coming from the Vermont Department of Health between June 2020 and June 2021 seem to be significant contributors. There's also a significant decrease in the number of aides and substitutes. And what we've all known to be true is a continuous shortage of childcare providers and staff, with fewer individuals entering and pursuing this field. Next slide, please. So next, we're going to talk about the mental health workforce. And similar to what we saw in childcare, we're seeing significant vacancies in the mental health field. So what you're seeing in the bar chart on the left is a 72% increase in vacancies in Vermont's designated agencies and specialized service agencies between June 2020 and August 2021. And we actually received an update just this week from the Department of Mental Health that the number of vacancies has increased to 970 as of September 2021. So when we're looking at this data, we know that there was also a 31% turnover rate system-wide across our designated mental health agencies and specialized service agencies, which is reported to be the highest it's ever been. Next slide, please. So when we think about what this means in comparison to the national context, we're also seeing significant trends of resignation and transitions due to the workforce turmoil in our country as a whole. So 2.9% of the American workforce left their jobs in August 2021, which is, again, the highest ever reported. So what do we know about who's leaving the workforce? We know that resignations are highest among those 30 to 45 years old. The age group actually saw a 20% increase in resignations between 2020 and 2021. Early analyses also suggest that women are overrepresented in this idea of the Great Resignation phenomenon. For example, women make up 82% of roles in the personal care industry, including childcare roles. So what we're seeing is a disproportionate loss of women as compared to men, which is having this ripple effect on the ability of the larger labor force and the economy. And this challenge is particularly acute in Vermont, where we've seen a loss of 28,000 people from the labor force, which includes those both working and looking for work over the course of 15 months. And when we've reviewed data across our region, Vermont's labor force declined by 1.5%, while Massachusetts' labor force increased by 2.6% from August 2020 to August 2021. So what we know is that there's a clear need for statewide cross-sector strategy urgently needed to recruit, retain, and sustain Vermont's early childhood workforce in order to meet the needs of children and families now into the future. Early childhood partners statewide have highlighted a range of strategies to address some of these challenges through the 2021-2022 recommendations from Vermont's Early Childhood State Advisory Council Network, and we'll talk through some of those at a later portion of today's briefing. So Dora is now going to walk us through the highlights from the rest of this year's report.
Thank you, Morgan. As we know, policies, procedures, funding, and actions have both intended and unintended consequences. When decisions are being made, it's important to understand who will be impacted in order to protect vulnerable children and families. Here are 4 examples of data to consider. Although the vast majority of Vermont's population identify as white, the state is growing more racially diverse, especially among young children. This table shows that the percentage of the population under 10 who identify as 2 or more races or multiracial is 4.6%, more than twice that of the Vermont population as a whole at 2%. Similarly, 2.9% of children under age 10 identify as Hispanic or Latino, compared with 2% of the population as a whole. The next is that 55% of Vermont's children live in just 4 of Vermont's 12 regions, with a full 1/4 living in Chittenden County alone. 96% of children under 9 have some type of health insurance, and 81% of families report that the insurance for their children is adequate, with reasonable out-of-pocket costs, benefits that meet their children's needs, and the ability to seek out medical care when necessary. Lastly, 35.7% of children under 6 live in households with incomes below 200% of the federal poverty level. Let's dig into the potential implications of this last indicator. Next slide, please. The stress of being unable to meet the basic physiological needs of food and shelter, often due to poverty, impacts the ability of parents and caregivers to create an environment where children can thrive. We all know there is a housing crisis. It is hard to find any housing, let alone affordable housing. For homeowners in Vermont, more than 1/4 spend more than 30% of their income on a mortgage. The number is even higher for renters, with 55% of households spending 30% or more of their income on rent. Over the last year, there have been 2 ways that Vermont has supported those families where children do not have secure housing. First, there was an increase in the number of children housed in motels each night from approximately 200 before the pandemic to approximately 425 through this fall. This is related to the increased flexibility and utilization of Vermont's general assistance and emergency housing, or motel vouchers, and Vermont's prioritization to safely shelter children in motels. The second way is through the expansion of the Family Supportive Housing Program, which provides intensive case management and service coordination to homeless families with children, following evidence-based practice for housing families with complex needs and multiple systems involvement. As you can see here, in 2021, Family Supportive Housing served 327 families with 608 children, compared to 201 families with 289 children in 2020. During the year, Family Supportive Housing also expanded service from 7 to 10 Agency of Human Services districts and increased its maximum capacity by 90%, from 150 to 285 families. One part of the early childhood system that these families may be involved with is focused on meeting mental health needs. Next slide, please. After the isolation that children and families experienced during the stay home, stay safe order, remote and hybrid schooling, and fewer opportunities to engage with peers and receive necessary services, there is ample anecdotal evidence of an increase in behavioral, emotional, and mental health conditions. In last year's report, we identified our mental health indicators as data to watch over the next few years. Like most of the information we are presenting today, we still do not know the full implications of the pandemic. However, as you will see, there is an increasing trend in the percent of children with these conditions, although the utilization of services is not necessarily matching that increase. This information is important because children and adults with mental, emotional, behavioral, and developmental conditions often require additional services, resources, and supports. As you can see here, there has been an increasing trend over time in the percent of behavioral, emotional, mental health, and developmental conditions for Vermont's children between the ages of 3 and 8. Both the light blue bars for children 3 to 5 and the dark blue bars for children 6 to 8 show an increase over time. As you're thinking through this data, we want to be clear about how the National Survey of Children's Health defines a behavioral, emotional, mental health, or developmental condition. There are 10 conditions which are included in these categories: ADD and ADHD, anxiety, depression, behavioral or conduct problems, autism or autism spectrum disorder, developmental delay, intellectual disability, learning disability, speech or other language disorder, or Tourette syndrome. The increasing trend over time remains when the developmental disabilities are removed from the broader grouping to only include those conditions in bold: ADD, ADHD, anxiety, depression, and behavioral or conduct problems. From 2018 to 2020, the percent of children ages 3 to 8 with one or more of these conditions increased 33%, from 8.7% to 11.6%. When we zoom out to include all children under 18 and compare Vermont to the US, the increase is striking. As you can see in this chart, the percent of children in Vermont with one of the 10 behavioral, emotional, developmental, and mental health conditions has increased from 23.7% in 2018 to 29.8% in 2020. That means that almost 1 in 3 children in Vermont has one of these conditions. I'm going to pause for a moment to let that sink in. Almost 1 in 3 children in Vermont has a behavioral, emotional, developmental, and mental health condition. The yellow bar on this chart shows the same information for the US as a whole, which has not increased to the same extent. The Department of Mental Health is monitoring this data alongside our team and will explore this more through the annual System of Care report, which will be released along with recommendations later this month. As we move into service utilization on the next 2 slides, it's important to note that these indicators do not capture the current need for either service, only the utilization. However, along with the increasing percent of children with a condition, there is ample anecdotal evidence that the need for children's mental health services is increasing, not only in the number of children requiring services, but the acuity of those needs. As can be seen here, the number of young children accessing routine services from designated mental health agencies has remained relatively unchanged since 2011. When we look at crisis services, the number of children under 9 receiving services has actually decreased since 2019 from 265 to 198. However, it is difficult to interpret this as a trend given the likely impact of the COVID-19 pandemic on people's comfort with accessing services, as well as the workforce shortages. There is clearly a mismatch between rising rates of children with behavioral, emotional, developmental, and mental health conditions and the either constant or slightly decreased rates of utilization through designated mental health agencies. Again, we likely aren't seeing the true trends resulting from the COVID-19 pandemic or factors like the workforce crisis and equitable access to services. The policy recommendation to respond to Vermont's mental health crisis has concrete strategies for the present moment, even without knowing the true trends. One of these recommendations is to expand the connections of mental health in primary care and education settings. Next slide, please. Access to affordable, high quality early care and education and after school programs affects more than the parents and caregivers of young children. It affects the businesses that employ them and our larger economy. Vermont's early care and education system consists of a mix of programs that serve children from 6 weeks to 5 years old, and though not yet in kindergarten, including licensed and registered family child care programs, center-based programs, and school-based programs. Like the mental health data above, enrollment data do not tell us about the demand for early care and education, but are important to understand when considering funding and other resources to ensure equitable access. As you can see here, the vast majority of children receiving care in regulated childcare are enrolled in center-based programs at 84%, followed by 15% in registered family childcare programs, and then less than 2% of children enrolled in licensed family childcare programs. You can also see that the number of preschoolers enrolled is higher than the number of infants and toddlers. Next slide. At least one of the reasons for that is Vermont's access to publicly funded universal pre-kindergarten education. In Vermont, all 3 and 4-year-olds and 5-year-olds not yet enrolled in kindergarten receive 10 hours a week of publicly funded pre-K. Vermont has a mixed delivery system for UK, meaning that these hours can be used in school-based programs, but also in pre-qualified pre-kindergarten center or family childcare program. In the fall of 2021, 54% of students were enrolled in private pre-K programs, with the remaining 46% enrolled in school-based programs. The breakdown by program type varies by region and by supervisory union and school district, with enrollment in private programs ranging from 2% in some areas to 98% in others. As can be seen in this chart, across Vermont, there was a decline in the number of children enrolled in universal pre-K programs after the pandemic began. In the fall of 2019, there were 8,666 students enrolled, compared to the fall of 2020 with 6,673 students, a drop of 2,000. Enrollment in fall 2021 has remained unchanged with fall 2020 levels at 6,675. There are several factors thought to be contributing to the lower than expected enrollment, including concerns about COVID-19, program capacity and choice, cost of additional hours for non-school-based programs, scheduling and transportation challenges, and parent and guardian employment. Like all facets of education, assessment data was impacted by the COVID-19 pandemic. In last year's report, we were able to include data on teaching strategies gold for pre-K students. However, with the TS Gold Spring 2020 assessments were not conducted, and the data for Spring 2021 are not yet available. While statewide third grade language arts or reading and math assessments were conducted, and we are sharing that data, it is important to note that the results should not be compared to the previous year's results. While educational assessments are just one of the ways that we monitor the impact of programs, services, resources, and supports, the inability to compare these results to previous years is an added limitation to our understanding of how to support children, families, and educators. That being said, as can be seen here, proficiency rates vary significantly based on economic status, race, and homelessness. In addition to these student characteristics, which are reported across the country, Vermont has opted to include 2 additional groups, primarily to increase transparency around student performance. Vermont's small schools and relatively low levels of diversity often mean that student groups are too small to show data which might point to inequities in experience. The 2 groups are historically marginalized and historically advantaged. Historically marginalized students are those students who have been historically underserved by educational institutions for any one or more than one characteristic, including ethnic and racial minorities, students with disabilities, English language learners, students with free and reduced lunch, and students who are migrant, foster, or homeless. Historically advantaged students are those who have none of the characteristics that are associated with being underserved. By creating a larger group that accounts for many characteristics, Vermont is able to share with the public more information about equitable learning experiences in Vermont. For third grade reading and math, the comparison between historically marginalized and historically advantaged students is striking. For historically marginalized students, 27% are proficient or above in both math and reading, while the rates for historically advantaged students are 59% and 57% respectively. While this year's report is by no means exhaustive, there are many other parts of Vermont's early childhood system that are covered, including measures of toxic stress and resilience, early identification and intervention, and food security. If you have questions, comments, concerns, or have found an error, please do not hesitate to reach out to data@buildingbrightfutures.org. We will do our best to answer your question and connect you to the experts who may have more to share. Now we are going to transition from talking about the current state of Vermont's children to recommendations to improve the well-being of each and every child and their family. Morgan?
Thank you, Dora. You did an excellent job providing that snapshot of data. And the next section of this briefing is focusing on the 2021-2022 policy recommendations that were endorsed by Vermont's Early Childhood State Advisory Council Network. So as a brief reminder, the State Advisory Council sets priorities and strategy in partnership with Vermont Early Childhood Action Plan committees and our 12 regional councils. Annually, recommendations are developed to identify current gaps and needs in policy, promote action in strategic areas for the coming year, ensure that the recommendations are measurable, and move Vermont towards a more equitable early childhood system. So this year, we've maintained 5 key policy areas that were originally outlined at the start of the COVID-19 pandemic in 2020. These recommendation areas signal where there are barriers that need a strategy to reach resolution as a step towards policy change. And you can find these published on pages 4 through 9 of our report and on vermontkidsdata.org under the policy tab. So the 5 policy areas are listed on the screen that you're seeing now. Respond to Vermont's mental health crisis, address chronic inequities in Vermont's early childhood system, elevate families as decision makers, develop a well-resourced early care and education system, and evolve the early childhood data system and infrastructure. I won't be going into detail in each policy area, but you will hear a little bit about how action's being taken on 2 of these areas throughout the Bbf network right now. And while it's really important to call attention and publish and document this series of recommendations, it's really important that all of our stakeholders across sectors understand how to use these policy recommendations. How can you actually move them to action to inform decision-making, resource allocation, and policy development? And that includes all stakeholders, families, parents, legislators, directors. And I think the major goal of talking about these policy recommendations in this brief TA session is that anybody who cares about kids and families can pick up this report, look at these policy recommendations, find something they care about, and then use it to make positive change within their program, sector, division, department, agency, wherever you sit. And that you can pair those recommendations with the data we're presenting today and at vermontkidsdata.org. So why are these recommendations important? We asked our State Advisory Council members to share some of their reflections on the next slide. So first, recommendations give us common language to use when there's political tensions to navigate and to align our efforts and reduce obstacles. They can serve as a resource for anyone who's seeking to make policy change and motivate decision makers in targeted areas. Recommendations can also reiterate the importance of issues that the entire state's dealing with. They're specifically calling attention to the urgent priorities and strains on our early childhood system. And finally, recommendations are validating the work that we're doing. Every recommendation needs to have a champion and someone to move them forward. And I want to reiterate today that those champions and anyone that's moving this data forward and these recommendations forward has the backing of our State Advisory Council and the Early Childhood Network. So the next step is, how do we actually move data and recommendations to create change? Next slide, please. So the following are some examples of how our partners across the Bbf network either have already used or have committed to using these recommendations within their work. And there are 4 bigger buckets. The first is that the legislature, commissions, and task forces are using this information to set priorities, policy development, and decision-making. And so this collaborative public-private partnership to developing policy recommendations is what allows decision makers to hear from a coordinated cross-sector voice that's signaling these priorities and needs for kids and families. Legislators are using this data and the policy recommendations to build responsible policy for kids and families in Vermont. And commissions, task forces, and committees are using this information to inform their priorities and monitoring accountability in and across the early childhood system alongside building bright futures. Our agency leaders and other state of Vermont partners are using this information to also set priorities and for fiscal decision-making. So for example, some of our State Advisory Council agency leaders have committed to using this data and policy recommendations to develop any state plans that might be required under the Build Back Better Act or other federal initiatives that are on the horizon. These recommendations are also really important to the administration in identifying targets and priorities for and alignment with state and federal funding opportunities. So for example, ARPA and COVID relief funding or annual budgeting cycles. Next slide, please. We've also heard from community, academic, programmatic, and advocacy partners that they're using this information to set priorities and annual strategy, right? So our regional and community partners are using data and recommendations to determine how and where to focus their efforts, to develop their strategy, potentially for continuous quality improvement in programming, or to support their advocacy efforts for the coming year. Academic and leadership development colleagues are sharing that they are providing this data and these recommendations to their students to help them keep apprised of early childhood policy in Vermont. And lastly, whether you run a nonprofit, a state agency, or a legislator, really anyone can use the family engagement and empowerment recommendations to ensure that the family's perspectives are accounted for in policy decision-making and that we are not embedding systemic inequities accidentally. So in this way, we're really working to create a system that actually works for families. So for example, ensuring that family voice and the lived experience of those most impacted is included in all places where decisions are made. And one way that Vermont and the Bbf network are putting these recommendations into action is through the creation of an early childhood educator pipeline through the Step Up to Childcare program. And here to speak about this program is Linda Miknowitz, a regional manager for Orleans, Essex, Caledonia, and Lamoille counties. So I'm going to turn it over to Linda. Thanks for being with us.
Thank you, Morgan. I'm really happy to be here today to talk about this program. We often talk about the potential for integration and the alignment of resources toward a common vision. A concrete result is not always easy to see. However, the Step Up to Childcare program is just that, a shovel-ready curriculum supported by a cross-sector group of organizations, agencies, and funding sources that will increase the early childhood workforce, which in turn will increase equitable access to children and families. The Lamoille Valley Regional Council Action Plan has been aligned with the policy recommendation to respond to the early childhood educator workforce crisis by investing in compensation, recruitment, retention, training, and professional development. Step Up to Childcare is one strategy that the council is using to address this recommendation in Lamoille County. This program is a 3-month apprenticeship-style training program designed to prepare individuals to acquire fundamental skills and knowledge of the early childhood field. The Step Up to Childcare program is similar to the Vermont Early Childhood Pre-Apprenticeship program for high school students, but expands the opportunity to adults who have completed their high school education. Participants are introduced to the Northern Lights Early Childhood Career Ladder and are supported in continuing their education in the field if they find it is something they want to pursue. In the Northeast Kingdom, the Bbf Regional Council has been supporting Northeast Kingdom Learning Services in promoting the Step Up to Childcare program since 2019, first in Newport and expanding to St. Johnsbury. There have been 3 cohorts, with a 3rd starting today. One of the 3 initial cohorts was specifically designed to meet the startup needs of the Ready, Set, Grow Child Care Center in Newport. The Step Up to Childcare program is now taking this promising practice beyond the Northeast Kingdom into the Lamoille Valley. This is a perfect example of the work of regional councils. Together, we identify challenges, priorities, develop strategies to address the challenges, and execute those regional action plan priorities. The interest in Step Up to Childcare in Lamoille County began as a conversation I had with members of the Working Communities Challenge Grant, Workforce Development, and Childcare Committees. The discussion expanded, and I invited Annie Cristoni from Northeast Kingdom Learning Services to speak about the program to staff from interested organizations, including Central Vermont Adult Basic Ed, Northern Lights at CCV, Sonia Raymond, owner and director of Apple Tree Learning Center, the Green Mountain Technical Career Center, and Bill Sugarman and DJ Mozzie from Voc Rehab, Vermont. It is exciting to see the alignment of resources and vision across sectors beyond the traditional early childhood system working together. The group took advantage of an opportunity to apply for funding through the newly launched Vermont Early Childhood Fund and were awarded a grant to launch the first cohort this year. In addition to learning about the expectations and requirements of the early childhood education career field, Step Up to Childcare includes professional skills training, commonly known as soft skills, and wraparound support services for each participant. These are some of the comments from participants that are now staff at the Ready, Set, Grow Center regarding their experiences on 3 key elements of the program. On accountability and workplace relationships, one past participant shared, "The training and lessons made me think more about how to handle situations in the field. I'm not sure if I would have been able to gain the skills I needed to use in the field without participating." On fundamentals of childcare curricula, another teacher participant said, "I have always wanted to work with kids, and Step Up to Childcare gave me the opportunity to gain the tools I needed to be successful. I wouldn't have been able to obtain the information or resources that I have now if it wasn't for this program. This program solidified the love I have in working with children." The most expensive part of the Step Up to Childcare program is the paid internship. However, it also makes the program more equitable and accessible for those who would otherwise be unable to pay for classes and take an unpaid placement. Commenting on the paid internship component, a teacher said, "The Step Up to Childcare program helped me enter the early childhood field by providing me the resources needed to do so. The paid internship was super helpful because at the time, I was a single mom of 2 young children." It has been rewarding to be a part of introducing Step Up to Childcare in the Lamoille County and to our Bbf Regional Council partners, and making essential connections within and between these regions. I'm inspired by the dedicated individuals working within our communities to meet a critical need. We are looking forward to getting the first cohort underway. Thank you.
Thank you so much, Linda. It's really amazing to show how 3 of our regional councils are really putting these recommendations into action. And, I'm really excited to see how this shovel-ready curriculum that's already been successful in the Northeast Kingdom will be adapted for Lamoille region and hopefully further. And we have folks already excited about joining your Early Childhood Regional Council. So we'll be sure to make sure that we are making those connections after the briefing today. But just as a quick note, all of our Building Bright Futures meetings are open to the public, and we are excited to have new and reinvigorated membership and excitement for how we champion support for kids and families in the state of Vermont. So now I'd like to introduce Jen Fortman, who is going to be speaking about the policy recommendation to elevate family voice. So Jen's going to speak both to Vermont's progress to date and upcoming opportunities to realize the potential of family engagement and leadership in this system. And Jen is a full-time stay-at-home mom of 2 children and also co-chairs our Bbf Families and Communities Committee, and also serves as the family lead for the Early Childhood Comprehensive Systems Grant that is federally funded through HRSA. So Jen, I'm excited to turn it over to you.
Thank you for allowing me to be here and share about the importance of elevating family voice and the impact it makes. The Families and Communities Committee oversees the policy recommendation to elevate family voice. Part of that recommendation is creating a culture that invites and supports family engagement and partnership and provides the necessary training and coaching to attract families who are unfamiliar or uncomfortable with the current process, language, and decision-making structure. The strategies outlined in the recommendation are to develop and use a common definition of family engagement and partnership, invest in strategies to engage diverse populations, provide training and coaching of professionals in order to successfully engage families as decision makers, to increase family participation in early childhood programs, and to measure impact and ensure accountability by conducting regular family engagement assessments. Next slide, please. The first family engagement assessment was conducted at the beginning of 2020. We know that it is essential that the data collected from families and parents directly inform the early childhood system. At the end of 2019, 22 parent ambassadors were hired and trained. They were compensated for their time and resources. They began to come together in the Families and Communities Committee and regional councils remotely to ensure as many family voices were heard as possible. Then COVID hit. It was an extreme challenge to shift from in-person peer-to-peer data collection to remote outreach, but it allowed families to still connect with other parents and have their voices heard while being isolated. Overall, we received a total of 423 survey responses throughout the state. This is one graph generated from survey results around families being treated with kindness at the location they chose on the survey. As you can see, 76% of all respondents felt that their family was treated with kindness, but when broken down, only 50% of Black or African American families felt they were treated with kindness, 55% of those who are more than one race, and only 63% of those who participate in 3 Squares Vermont. The recommendations that emerged from this report are to use a common definition of family engagement and partnership, create meaningful partnerships, commit to ensuring that children and families are in all policies, and increase understanding of families' experiences and break down barriers created by systemic, institutional, and individual racism. The results from this report helped create this year's State Advisory Council's policy recommendation to elevate family voice by the Families and Communities Committee. Next slide, please. The assessment also played a huge role in the growth and participation of families in the Families and Communities Committee. Some progress we've made is 3 parent ambassadors have taken on leadership positions. There are 2 parent representative seats on the State Advisory Council. The Families and Communities Committee now has over 51% family representatives. This is a huge accomplishment. It is a very unique opportunity, bringing together a group of families and caregivers with providers and professionals to the same table to implement change. It can be extremely empowering for families, yet also poses many challenges. Just one being needing to bring awareness around the time and capacity needed to prepare. For example, it has taken me about 7 hours being a full-time mom to prepare for this section of this presentation I'm giving right now, as well as needing to slow down during committee times and bringing it to a different level other than other committees. We do this by reading through each document thoroughly, out loud, allowing time for discussion and language translation, scheduling meetings around family schedules, welcoming children to join meetings, encouraging participants to step away if and when needed, holding space in a welcoming and respectful way, and inviting dumb questions so that we can all be in a similar understanding of the complexity of the early childhood system, which leads me right into growth opportunities. So the system I mentioned in the last slide carried over to how we run the Families and Communities Committee today. The VIP 3 grant of $1.3 million over the next 5 years ensures compensation is available for all family representatives and cultural liaisons, which helps make participations of all families possible. One of the main goals of this grant is to increase state-level capacity of family leaders, continue to recruit, train, and bring family leaders together in a space that is welcome, inclusive, and comfortable. Develop leadership opportunities for families in maternal and child health and early childhood initiatives, and increase opportunities for families to engage with and lead state-level early childhood initiatives. Since we received such robust and important data from the family engagement assessment, we will develop regular assessments conducted by parent and caregiver leaders. So with these opportunities in mind, there are still some questions that need to be addressed. Next slide, please. What does family leadership and engagement actually mean and look like? How are we supporting both leadership and engagement? In what ways can we support family leadership? How do we provide a space where families are comfortable and are truly welcome at the table? And how are we holding ourselves and each other accountable? Thank you again for this opportunity to speak on behalf of Vermont's parents and families. I look forward to working with you to help elevate family voice.
Thank you so much for being with us today, Jen, and for the amount of time it takes to prepare for a presentation like this. It's so clear that you are such a strong champion and leader for families and for kids in the state of Vermont, and that we across the state have committed to increasing the role of families in both the creation of and implementation of policies and programs. I'm really excited to see what these opportunities might look like as we continue to elevate family voice, especially when it challenges the status quo. So thank you so much, Jen, and all of our Families and Communities Committee for serving as ambassadors in this Bbf network. I hope you know that change is happening because of you. So I hope that this brief session on moving from recommendations to action has been a helpful first step in thinking through the ways that you can use these recommendations to create change in your sector. And as we move through the next year, the Bbf policy team is happy to provide additional support and technical assistance to anyone who's interested in taking actions in different policy areas. And we can connect you with VCAP committees who can update the status of these recommendations and how folks are using them. And so if you take anything away from this section on recommendations, I want you to take the following questions. The first is, how can you and your team be champions for some component of this work? What stories can you share to provide concrete examples? And how is your organization already tackling one or more of these issues? And where are there opportunities for collaboration? We want to hear from you and have you share your stories. As we finish our time together, I invite you to share in the chat bar what you've learned today about the state of Vermont's children and families in our state, and how you plan to use the report or the recommendations to inform decision-making. So the chat bar is now open, and I invite you to share your reflections, and we will take a couple of minutes at the end for discussion. I recognize that we are just hitting time, so if you have to go, we are recording today's session and we'll make it publicly available after. So looking forward, Building Bright Futures is going to continue to monitor service provision and outcomes for kids and families. It's really important for you to know where to go for this data. And we're excited to announce Vermont's Early Childhood Data and Policy Center, which is at vermontkidsdata.org. And this is where you can go to get information on the topics you care about or get connected to key data. So the back cover of our report, which includes the graphic you're seeing on the left, teaches you a little bit about how to navigate this platform as a clearinghouse or hub for early childhood data in Vermont. So on the data front, if you have a data question, you can look and see what data exists through our data dashboard, which is searchable by topic area. You can also review a robust collection of Vermont-specific and national publications, policy briefs, and webinars that are organized by topic and year. On the policy front, you can track early childhood policy in Vermont by seeing the previous and current State Advisory Council network policy recommendations, information about what's happening on the federal policy level. So we've actually done a series of memos dedicated to understanding Build Back Better. And you'll also be able to see previous testimony that we've done to the legislature. Other places on this platform, you can absolutely ask a data question or get connected to data stores. I do want to take a brief moment to thank my guests for joining me today. Again, thank you so much to Jen Fortman, Linda Miknowitz, Dora Levinson, and Governor Scott. I also want to acknowledge so many partners who made this report and briefing possible, and want to very clearly call out our corporate sponsor, National Life, as well as funding from the state of Vermont. I also want to thank the many collaborators who provided the data and the narratives for this report. So in closing, a quick reflection on the state of Vermont's children as we enter 2022. You've heard some staggering statistics on the early childhood workforce and mental health challenges, some trends in child development and educational assessments, and then other challenges faced by kids and families. It was also an important opportunity to hear about the recommendations and how you can use them coming into next year. Vermont has and will continue to prioritize kids and families at every turn. If you haven't already, I also want to invite you to review the current status of Vermont's childcare and early childhood education systems analysis that's being conducted by our national colleagues from Foresight Law and Policy and Watershed Advisors. And you can find more information about that on the Building Bright Futures website. While there's still a ton of work to be done, we're making so much progress in identifying and supporting the needs of children and families in Vermont. We're consistently building stronger partnerships and collaborations across these sectors, especially with family members, to make sure that our priorities are in the right place. My team is proud to continue to support Vermont's early childhood community in consistently monitoring these needs and using data to serve as the primary advisor to the governor, legislature, and the administration on the well-being of children and families prenatal to age 8 in Vermont. And so, as always, we want to ask you as leaders and decision makers in this state this afternoon to reaffirm your commitment to early childhood and the well-being of kids and families. We must recommit to using evidence and data to inform decision making, and it's time to recommit to collaboration and the unified vision that we've outlined in Vermont's Early Childhood Action Plan. I hope this report makes you think critically about the status of our early childhood system, outcomes for kids and families, and the steps we can take to move towards that vision. We have an incredible opportunity right now to create the system that Vermont families need, and that change starts with every one of us. And I'm really excited to work with you over the coming year to make that happen. Thank you for being with us today.